My name is Bill Funder. I'm the Incentives Program Manager with the Oregon Office of Rural Health. I'm part of the Workforce Services team. Our team members consist of Stacy Reed, our Recruitment and Retention Manager, Annalie Vaneri, our Workforce Services Coordinator, and is led by Robert Dumeg, the Oregon Office of Rural Health's Deputy Director. I'd like to start off all presentations on a positive note, so please enjoy this barn full of puppies. During today's webinar, we're going to be going over some basic definitions. We're going to be going over the overview of the new loan repayment program. We're going to very briefly touch on provider applications, and we're going to go a little bit more in depth on site applications as this webinar is geared towards sites. Tomorrow's webinar, we're going to be going more in depth on the provider application as it's geared more towards providers who wish to apply to the program. So the Oregon Office of Rural Health is, every state has an Office of Rural Health, and we are Oregon's. We were created in 1979. We're housed at OHSU. We're charged with helping to increase access to health care for rural and urban underserved Oregonians. So what is rural? We have an official definition, and that is all geographic areas 10 or more miles from the centroid of a population center of 40,000 or more people. We have on our website a list of rural and urban communities by zip code. You can access that on our data section of our website. The link there is below, and when this presentation is made available, you'll be able to click on that hyperlink in the presentation. I'd like to show this map. Our website contains all sorts of great maps, this being one of them. It shows just how much of Oregon is considered rural and frontier. As you can see, actually relatively small areas, a small percentage of the area of the state is considered urban. Briefly, HPSAs, and why do they matter? HPSAs are the federal government's way of looking at health care access or lack of access for different groups of people in an area or seen by a clinic. They look at a couple of different factors and they assign a score. The higher the HPSA score, the greater the perceived need. HPSAs matter because all federal and state loan repayment programs, loan forgiveness programs, incentive programs, the common thread is that all of these programs are dependent on HPSAs. We'll go into that a little bit more here shortly. There are three different types of HPSAs: dental, mental, and primary. If you have a provider at your site who is interested in applying to a loan repayment program, either through our office or the National Health Service Corps, they have to have, your site or your area has to have a HPSA that is relevant to the provider's activities. For example, a mental health provider must be working in an area or at a clinic that has a mental health HPSA score. Again, the higher the HPSA score, the greater the perceived need. We won't go too far into too deep into how HPSAs are assigned, but it's a process between the Oregon Health Authority's Primary Care Office, interested parties, and the Health Resource and Service Administration, also known as HRSA. Again, that's not something that our office really is involved with. If you'd like more information on that, you can go to the Oregon Health Authority's website and check out how HPSAs are assigned. So, loan repayment. In 2017, the Oregon legislature created the Healthcare Provider Incentives Program, and loan repayment is an incentive included in that new program. Eligible providers for this program, I'm not going to read this verbatim. This information can be found on our website. It's also on the application. The common thread here is that providers must be licensed. They must be primary care providers providing care in an patient setting. Again, you can find all the full list, not only is displayed here, but also on our website and the loan repayment application and in our FAQs. Qualifying sites. For this program, each loan repayment or loan forgiveness program is going to have slightly different qualifications for what is an approved site. But for this particular program, a site must be located in a health professional shortage area or have a facility HPSA, and it must be serving the same amount of Medicaid and Medicare patients that exist in the county and have a site application on file with the Oregon Office of Rural Health. Site applications are valid for 1 year, so if you believe that your site may be kind of coming up on that year or you're not sure, feel free to give us a shout here at the Office of Rural Health. We'll be happy to let you know the status of your application. A little asterisk on the serving Medicare and Medicaid portion of this requirement is that if a majority of the providers at your site are eligible for only Medicaid or Medicare, that will be the factor looked at. We're not going to, for dentists, they're not going to be seeing Medicaid and Medicare, and your site won't be dinged on that. You're just going to have to be seeing at least the same percentage of patients for that program that exists in your county. Hour requirements. For the purpose of this program, full-time means that a provider must be working at least 40 hours a week with a minimum of 32 hours per week spent providing direct patient care, and part-time means working 20 hours per week with a minimum of 16 hours per week spent providing direct patient care. Patient charting is considered an aspect of providing direct patient care, but many other activities are not. Things like spending time on management activities. If you have a medical director, a team leader, director of pharmacy, all these kind of administrative that may be involved in patient care but are also involved in administrative duties, those administrative duties are not going to count towards the hours of direct patient care. That's not to say that someone like a medical director can't apply as long as they are meeting one of the two full-time or part-time hour requirements. So if you had a medical director who was seeing at least 16 hours of direct patient care a week, they may qualify for a part-time award. Clinicians who are employed in an inpatient setting in a full-time capacity are not eligible for an award. However, if you had a clinician who was splitting their time between inpatient and outpatient activities, they may qualify for an award as long as they're meeting at least 16 hours a week of direct patient care in that outpatient setting. In that case, they would qualify again for that part-time award. Award amounts. Full-time service providers, again, those providing at least 32 hours of direct patient care per week, are eligible for 50% of their qualifying educational loan debt at the time of their application, up to $35,000 per obligation year, and at a 3-year minimum service obligation. That means that full-time providers could possibly be eligible for up to $105,000 of tax-free money over the life of that 3-year service obligation. Part-time service providers also must commit to a 3-year service obligation. They are eligible for a tax-free award of up to 25% of their qualifying educational debt, up to a maximum of $25,000 per obligation year. So part-time service providers max out at a $75,000 possible award over those 3 years. When we're talking about the maximum award, generally providers like MDs, physicians, dentists usually end up at the top range of that PAs and Ps typically graduate with less debt, so while some may peg that top range, most will find themselves a little bit lower and not quite pegging out at that $35,000 or $25,000 per year. Other service obligations. If a provider accepts an award through any loan repayment, loan forgiveness program, they cannot enter into any other service obligation. Some of these obligations are obvious, like the National Health Service Corps. If they're awarded a loan repayment award, they cannot then turn around and accept an award through the National Health Service Corps. That's not to say that they can't apply for both, but if they are awarded and accept one of those awards, they cannot enter into another service obligation. A less obvious service obligation include employment bonuses and funds that require payback in full if a provider leaves a site before a set date. So if you were to offer one of your providers a signing bonus of, we'll just say, $20,000, and you have language in your contract that says if this provider who was given $20,000 leaves our site within a year, they are required to pay back that money in full. That is considered a competing service obligation. So that's something that you're going to want to think about. If you have more questions about that, please feel free to give us a call or send us an email. So again, we're going to touch just briefly on how providers apply for loan repayment so you can point your providers in the right direction. If you go to our website, if you type into a search engine, Oregon Office of Rural Health, we're going to be the first option that pops up. You'll see our home page here. The Providers tab. Before I get too far into this, I want to let you know that over the next coming weeks, possibly months, our website is going to go through a bit of a redesign. But it's actually going to be easier to find this information. What I'm about to show you here will at least not only help you out now, but will likely help guide you at least somewhat through our new site, which should be more intuitive. We're redesigning the site based off of feedback that we got from sites and providers looking for this information. So, but for now, click on the Providers tab. That will bring down a drop-down menu. Click on the Loan Repayment option. Once you click on that, it'll bring you to this Loan Repayment landing page, and there are two different places where you can access the main Oregon Healthcare Provider Loan Repayment webpage. Click on either one of these. It's going to bring you to the Healthcare Provider Loan Repayment page. Again, this is just a screenshot of the web page. If you scroll down, we have things like eligible provider types, we have site requirements, we have the actual application at the very bottom, along with some information that's provided elsewhere. But for right now, for the purpose of this webinar, we're going to focus on this related documents section, which is in the upper right-hand corner. It includes the provider application, also the loan repayment FAQs. I encourage sites and providers, before you go to fill out a site application or a provider application, to please check out our FAQs and give us any calls if you have any questions. But we're going to focus on this site application aspect of this program, which is located right there in the related documents section. So why should a site fill out an application? Not only is it a requirement for loan repayment that a site have a site application on file with our office so that is no more than 1 year old, it also allows my office to review your site for other programs. You may qualify for loan repayment, you may not, but there are other programs that you may qualify for that you don't even know about. We have one single application that allows our office to check your site for eligibility for all of these programs. It also allows us to keep you informed about things like this new loan repayment program. Many of you likely heard about this webinar because at some point you filled out a site application and you were listed as a contact on that application and you received an email. If you have changes at your site and your application is still valid, it's less than 1 year old, we still encourage you to reach out to us and update that site contact information. If someone who's a main contact at your site leaves, we would hate to lose contact with you, so please keep us in mind if you have changes at your site. So looking closer at this site application, it starts out with some basic information, including the name of your practice site and its location and contact information at your site. This portion for the site contact should be the main point of contact for your site. If you have an administrative person at your site that disseminates information to management or providers at your site, please list that person in that area. Another thing to keep in mind is when filling out an application, if you're part of a larger health system, you are going to be required to fill out a site application for each clinic that's interested in participating in loan repayment or loan forgiveness programs. So you can't fill out a site application for your parent organization and have it as an umbrella application for all of your clinics. So if it has its own separate address or its separate activities, it's going to require a separate site application. I know that can be time-consuming for larger health systems that have multiple locations, but it is required. And that's not to say that all locations in that health system have to submit a site application, but those who wish to have providers from that site apply to a loan repayment program or wish to employ loan forgiveness awardees must have a site application on file. Next is the parent organization section. Again, for larger health systems, this is going to be where you'd insert your information for your parent organization. If you're an independent clinic, not part of and don't have a home office parent organization, you can put none or NA in this section. Next, we're going to be asking for your HPSA scores. We also have a hyperlink on the PDF of this site application that will take you to a tool where you can research your HPSA scores by address. We also double check that here when reviewing site applications. If you have any questions about that, again, feel free to give us a call. We'd be happy to walk you through how to find your HPSA scores, but again, that's something that we double check here in our office. The next page of the site application asks you to go into a little bit of detail about whether or not your practice site is located in an area of Oregon that is designated as rural, and again, that is an official designation. The application has a hyperlink that will take you to the section of our website that has the document that shows the spreadsheet that has all of the urban and rural communities by zip code. And we ask that you indicate whether or not your site is a for-profit or nonprofit entity, and whether your site is a public or private entity. Many site applications, a fair amount of site applications that we get in, folks don't check both A and B. They'll say indicate whether they're a for-profit or nonprofit, but they leave the next section blank, which requires us to contact that site, which holds up a site application. So when filling out a site application, please be sure to indicate whether you're a for-profit, nonprofit, and whether or not you're private or public. The next is what was known as the designation of your clinic. Things like rural health clinic, federally qualified health centers, critical access hospitals. These are all official designations. You may be a clinic located in a rural community and not be a certified rural health clinic. There are hyperlinks next to each one of these options that will take you to a site where you can check on your status. And as always, if you are unsure, feel free to give our office a call, and we'd be happy to give you more information about that. Next, we ask if you are a PCPCH, which stands for Patient-Centered Primary Care Home, and if so, indicate your tier level. The next section of the site application asks for patient demographics. We're going to be asking whether or not your site sees Medicare, Medicaid patients, or both. Again, that goes to this will help us to determine what demographics we should be looking at when researching whether or not your site is going to qualify for loan repayment. And can help explain why, if the majority of your providers are only seeing Medicare patients, why you have a 0 Medicaid percentage. The next is the date range for the following patient demographics. We require at least 3 months of demographics. There's not really a maximum, but we do require at least 3 months worth of demographics. The next section is the total number of unduplicated patient encounters at the site for the date range listed above. We get a fair amount of questions on what does it mean to be an unduplicated patient. And unduplicated patient is if you have, say, have a total of 50 office visits during that 3-month date range, and you have a patient one single patient who comes in once a month for all those 3 months, they are only counted as one unduplicated patient. Next, we ask for your percentage of sliding fee schedule patients. If your site does not offer a sliding fee scale, you can put 0 or NA here. We ask for the percentage of Medicare and Medicare patients. Again, this is the percentage of patients that are included in that number of unduplicated patients, which is included in the date range listed above. We also ask for the number of patients that your clinic sees that fall below 200% of the federal poverty level. If you don't track this information or don't see these patients, again, you can put 0 or NA in that column. The next section spans 2 pages, so I've combined them here in this slide. And they're asking some information here. We won't go into detail on each and every one, but an executive director or legal representative of your site must initial next to each if they can answer to the affirmative of the statements A through H. And for A and C, if your executive director or legal representative does answer in the affirmative to these 2 questions, you must submit documentation that speaks to that specific section. Something that trips up a lot of folks especially is Section C. If you answer the affirmative of Section C, you're going to have to attach a copy of your policy saying that you offer discounts for people that fall below 200% of the poverty level. You're going to have to include your actual sliding fee scale, and you're going to have to include the application that the patient fills out. If you don't attach it, we will have to come back to you and ask for those things, and that can delay your application being fully reviewed. So if you do answer to the affirmative to A and C, again, please attach copies of those policies and any related documents. So we've covered this portion of, top portion of this slide in the previous section, so we've grayed that out. Next, we ask that, that the executive director or legal representative who initialed to the affirmative to the statements above sign this site application and include their email address and phone number. And then just below that is the section of the application where that includes the email address and fax number of where this application can be sent in. This site application is a fillable PDF. We do accept electronic signatures, and electronic submission is preferred. You can fax it in, but we find that sometimes from one fax machine to another, we do get some quality loss out of there. And if your application isn't legible, we will have to come back and ask you to resubmit it. So electronic submission is the preferred method. So incentive programs are great, but they're only a tool, and our office can help you expand your toolbox. We administer 3RNet, which is a job board for rural and underserved clinics that connect with providers. We can help you identify strengths and weaknesses and help you to overcome challenges at your site. We can connect you with loan forgiveness providers. Loan forgiveness providers are those who have been given money during their schooling to help pay down educational debt and then graduate from medical school with a service obligation at a qualified site. And if your site qualifies, you may be able to house or employ one of these loan forgiveness providers. We can also help you in developing recruitment and retention plans and a whole lot more. So, you know, while this presentation has focused on this loan repayment program, there's so many other things that we can help you out with. Check out our website. Please feel free to shoot us an email, give us a call. We'd be happy to go over all the ways that we can assist you in your community. So with that, I would like to open up the floor to questions. If you have any questions, again, you can move your mouse to the upper right-hand corner of your screen. That will open up an option window. If you click on the exit full screen mode, you will enter into, it'll open up a chat window. You can type your questions in there. Alternatively, we can try there's an option to raise your hand, and I can attempt to unmute your line. However, I've encountered mixed results with that. So if you have a question, please type it into the chat box. I see that we've got at least one come in. Or you can try to raise your hand, and I can try to unmute your line. But again, mixed success there. So Bridget asks, is there an application time frame each year? So no, Bridget. For site applications, we accept those year-round. For provider applications for this loan repayment program, they are available online now, and those applications will be up all year long. We do have cycles. This current cycle is going to end May 11th, and applications received after May 11th or those that are submitted and are incomplete and the provider hasn't gotten us the paperwork back before May 11th will be moved to the next application cycle. So, Bob Jones would like to know, if a provider had loan forgiveness that did not eliminate debt, can they obtain loan repayment? So, yes and no. So yes, there are some loan forgiveness programs that pay off a majority of the schooling, or a portion of the schooling, but not all, and those providers will still exit medical school with some debt. Yes, they can, but they first must complete their loan forgiveness obligation. Once that provider has completed their loan forgiveness obligation, they can apply to a loan repayment program. So if your site employs a loan forgiveness awardee, and there's the National Health Service Corps Loan Forgiveness Program, and also ones administered by our office, as long as their obligation date has ended, they can apply to those programs to help pay down the remainder of their debt. Do we have any other questions? Don't see that anyone's typing. Again, you can access your chat box by moving your mouse into the upper right-hand corner of your screen, hitting the exit full screen mode. The chat box will appear, and you can type your questions into there. And alternatively, again, you can attempt to raise your hand, and I shall do my best to unmute your phone line. And if we don't have any questions that pop up, this webinar, again, is going to be recorded. Sometime next week, we'll have this posted up on our website. And, again, you can always reach out to us with any questions that you may have. All right. So either the lack of questions means that that I've done such a great job that no one has any questions, or everyone is so confused they have no idea what to type. I hope that we have answered enough questions here that everyone has their questions. Oh, we have a participant raising their hand. Linda, I'm going to do my darndest here to unmute your phone line. Again, mixed results here. We'll see what we can do. I'm going to see if moving up will help. Perhaps. Oh, Linda's typing. I appreciate that, Linda. Again, mixed results on the unmuting phone lines from my little presenter window here. So, Linda asks, is there an employment timeline? Do they have to be a new employee within 24 months? So no, Linda, the previous program, the Medicaid Primary Care Loan Repayment Program, had a requirement that a provider could not have been at a site for more than 24 months. This program, this new loan repayment program, did away with that requirement. So you can have a provider at your site who has been there longer than 24 months apply to the program. So, if there are any other questions, please begin typing them now. I can tell when people start typing a question, but we'll give it just a little bit here. And if no one starts typing a question, then we'll just go ahead and close this out early. Again, this webinar will be posted online. You can reach us, reach out to us at any time. Our email addresses are up here on the website or on your screen, as well as our phone number. Please feel free. We're always here for you. If you have any questions at all, big or small, feel free to reach out to us. We're more than happy to let you know if you're part of a larger health system. Perhaps you're unsure of which of your clinics have applied to be considered for loan forgiveness and loan repayment programs. Maybe it's been a while since you've submitted an application. We'd be happy to tell you which sites are coming up on having their applications expire. And again, if you're interested in hiring loan forgiveness students, we have a new batch of graduates who are going to be graduating here right around June, and those providers are going to have obligations at approved sites. So all the more reason to get your site applications updated, see which programs your site qualifies for, and keep in touch with us so that we can help you not only with this program, but connect with other programs and providers.